welcome to another episode of Abdominal X-ray. These are special techniques that we have to take note of during our procedure. So I'll take you through some of the techniques you have to adjust and some of the things you have to also do to get a very good and quality images. Respiration is the process of getting oxygen into the body and releasing carbon dioxide. We do cases that requires inhalation and exhalation. For instance, chest X-ray, we do it by full inhalation. Some cases in chest X-ray, we do it by full exhalation. Example, pneumothorax, air trapping, foreign body, and others. When it comes to abdominal X-ray, it also depends on respiration. Now, full inspiration to expiration, the diaphragm position moves vertically about 10 centimeters, and anatomically, the diaphragm is at the level of T10. And this movement of the diaphragm changes the pressure placed on the abdominal structures. So on full expiration, the right side of the diaphragm dome is at the same transverse level as the 8th and 9th thoracic vertebra. And when the patient inspired in air, the diaphragm level also moves as low as at the 12th thoracic vertebra. Now, let's look at what happens when you do it on full inspiration. So on inspiration, it has been found out that contour mortis may also result in AP upper projection that are obtained with full inspiration. When the three automatic exposure control chambers are chosen, because the outside automatic exposure control chambers will be positioned beneath the lungs instead of the abdominal structures. So, this quantum mortis is a type of radiographic noise directly related to the number of X-rays or photons exerting the patient and forming the radiographic images. So if fewer photons reaching the images, it will cause undesirable in image density, resulting in images with gray and or sun-like appearance, like the one you are seeing, the A. And the C one is very good or optimal image. And the automatic exposure control is a radiographic density control device that terminates the exposure when a predetermined amount of radiation has been reached. So with this, part of the lungs is much exposed. So this image was taken on full inspiration. So if the automatic exposure control chambers are positioned this way and this way and this way, most of the X-rays will reach the image receptors in the lungs first as compared to the abdomen. Hence, some of the X-rays in the abdomen might have not reached the image receptor by the time the ones in the lungs has reached the image receptor. Therefore, stop the exposure, and it will cause a noise in the abdomen. This is because most of the X-ray has not come out from the patient onto the image receptor, therefore causing noise. So when you look at the image, you see that there's a noise here, going upwards is very clear. So on full inspiration, quantum mortis might also result in that. So let us also take note when we are doing abdominal X-ray not to place our automatic exposure ionic chambers. Maybe you don't have to choose 3. You can choose one. It's experiment. I have to find out whether it will work or not. Now let's go to doing the examination on full expiration.
Relaxes, it expands and forces the air out.
So a study was
This
done
is how we
by
breathe.
one Chinese. It was to evaluate the quality of
Move the
abdominal
diaphragm
X-ray.
and give you more power to empty your
So he
lungs.
conducted the test in a hospital and then evaluating all the abdominal X-ray examination by applying the standard of image evaluation for each region of the body. We found out that the images taken at expiration contain more information than those taken on inspiration. So the above study, as he was saying, implies that regarding general X-ray examination, information we can find from the images may differ significantly according to the region examined, examination purpose, or movements during the examination, like breathing. And also, it has been found out that expiration is preferred for AP abdominal projection. This is because it places less diaphragm pressure on the abdominal organs, resulting in more space in the peritoneal cavity and less abdominal density. So the information on expiration will be much greater than inspiration. So I decided to also add further about some technical factors you have to adjust for certain patient conditions. For instance, if you have bowel gas, what are some of the technical factors you have to apply? So from the routinely set technical factors obtained from AP, body measurement of patient with suspected large amount of bowel gas may cause higher overexposure and saturation in area of the abdomen that are overlaid with gases. And the patient measures the same whether gas or dense soft tissue causes the thickness. This decreases brightness results from the low tissue density characteristics of gas. As the radiation passes through the body, fewer photons are absorbed where gases is located than where dense soft tissue is present. So to compensate for this situation, you have to decrease the exposure MAS 30% to 50%, or the KV 5% to 8% from the routinely used manual techniques before the projection is taken. And also for conditions such as ascites, obesity, bowel obstruction, or soft tissue mass, what you have to do is, in this situation, we know that underexposed projection may result when patients have ascites, obesity, bowel obstruction, or soft tissue mass. This is because section of the abdomen that normally contain gas or fat do not, resulting in an increase in the tissue of the density of the soft tissue. So to compensate for this situation, you increase the exposure MAS 30 to 50%, the KV 5 to 8% from the routinely used techniques before the projection is taken.